social distanced as much as we could. But one thing that has helped us curb this disease and keep us healthy is, of course, vaccinations. We are lucky that we are able to receive the three series of the vaccinations that are out there, that is Moderna, Pfizer, and Johnson & Johnson. These vaccinations are free. We have mobilized, encouraged, tried to make sure that we sensitize, because there's a lot of propaganda, negative propaganda when it comes to vaccinations. We sensitized the community and told them to vaccinate, such that we are lucky that I think majority of our members have been vaccinated. Why? Because a lot of people in the US, especially us as immigrants, work in the healthcare system. And healthcare, as you know, is, I think, the biggest employer here in the US, really, per se. But many of our members work in health. In order for you to work in healthcare, most of the entities actually mandated it that people had to be vaccinated, because you had to protect those that you take care of. Whether you are a bedside healthcare worker or whether you are someone like some of us who are in administration. So vaccinations have been one of the ways that we have mitigated this disease. And we continue to encourage people to get vaccinated, because even with the series that is out there, the current series that you guys are having as a second wave, it's spreading over to the other countries. Yes, it has moved to the US, but the good thing they say is that the vaccinations that we have actually protect us from it. So we continue to encourage people to do that. And you'll also be seeing that in the messages that we send out for people who are coming to our convention. We are encouraging that all the people who are coming to attend are either vaccinated or should have a negative PCR, because we don't want to have anyone get sick. We don't want to have any spread of disease as we congregate as members. And most likely we are going to still follow the SOPs, such as make sure. Now, your question also was, how are we working with people back home? If you know, if you were able to watch me, I think it's 2 weeks ago, I was in Uganda delivering protective equipment to healthcare workers. Some people have asked me why I did not take these PPEs to the layman in the villages or the people who don't have them. But I also would like to let them know that the people who are hit most by this disease are the people who take care of those that come to them when they are sick. What you guys are going through in Uganda is what went through here in the US. At one time, we had healthcare workers who were reusing PPEs, who were reusing these things to take care of themselves, and some of them were getting sick. And we even had a lot of deaths in the hospitals. So I think the healthcare workers in these entities needed to be protected first. And also, the people at home have been encouraged to wear the masks, like the masks which were provided by the government, like masks which are even homemade. And I think if they follow the SOPs, they are far better off than the people who are in the hospitals. We are so glad that we were able to donate masks. We're N95 masks that are hospital-grade masks used here in the US. We were able to donate full cover PPE gowns. We were able to donate face shields. We were able to donate some sanitizers and also some gloves, all because we were able to partner with physicians here, Dr. Minaxi Rathford and Dr. Henrietta Wamala, who came in aid and said, we are happy to work with UNAA to make sure that we can get these items and make sure that these items are donated to those that need them most. And also we have some of our leaders such as Miss Josephine Mugaga Matovu. By the way, she lives here in Illinois and she's the representative of the Great Lakes region. Miss Georgina Nyakairu Chirunda, the one that is in Georgia, who is also a leader. And our queen, Miss Vanessa Nasamba, they donated towards this cause to make sure that these PPEs were transported and brought back to Uganda to help people. And Josephine is an RN, she's a registered nurse, so she knows what it means to take care of the sick. She actually mobilized and got some more PPEs which were added on the main donations that were given by the doctors, and we were able to give Iganga Hospital, we were able to give to Ginger Referral Hospital, we were able to give to Kamuli Hospital, we were able to give to Chichusa Luwero Healthcare Center, and we were able to give to Kasangati as well. So we are grateful that we were able to at least give those items to those hospitals in the past few weeks. And the healthcare workers,
thank you very much.
Some of them have sent us messages to say they are grateful. So we are grateful to have helped.
Yeah, even here at UBC, we are really grateful that actually this information is coming out, and we are sharing it with the public, with the audience, that really Ugandan North American Association, like the UNAA, is doing quite a great job. But one would ask that, of course, the areas you've mentioned, the donation came to a handful of areas. I mean, very few areas. What of the rest of the country, especially like northern Uganda, western Uganda, in this particular pandemic? What plans do you have for them? Then the other issue that also because you really, I can see your heart and thoughts are with hospitals because you have a medical background. But also let's look at the other sectors because the UNAA is such a big organization that brings about 20,000 Ugandans together. So let's look at other sectors. How is UNAA planning to help?
When someone asks, what about the other areas? I had such a short time to be there, and we had just that load that we had so far put together. By the way, I'm working on another load that we are putting together. And once we have enough to transport, now those are going to go to Western Uganda. Before I forget, we actually helped a couple of healthcare workers that reached out to us in Western Uganda, in Bundibujo, to be exact, whereby I had boxes sent to them through a friend of mine who works in New Vision. Remember, you guys are in lockdown, so my movement was limited. I could not move so much within the country to make sure that I was getting all these things donated, and I only had 1 week in Uganda to be able to do that. So to those other regions, such as the Western region and the Northern region, we are putting together another consignment of donations, and we'll make sure that those donations come and reach to where they should be, because we don't want to just put them into an air freight and then they get lost and someone either uses them for their own personal gain. We want to make sure that these things reach their recipients. When you think of the other entities in UNA, we do not only look at healthcare as the entities that we look at. We also have other sections that we look at, such as education. We also have other sections that we look at, such as business in UNA. And when we talk about business in UNA, we talk about our business folks, our people that either are members, either are partners, or even the general Ugandans that would like to do business with us. We have a full day trade and investment forum usually when we have a convention, and we cater for just that. During COVID, we have actually introduced a series of forums that touch business, that educate, that encourage, that inspire, that bring resources to our business people. Just a few days ago, I actually sent an email to our business people here, whereby we are partnering with MBDA, that's the Minority Business Development Agency here in the US, that also works with the US Department of Commerce. And they would like to know who are the people that own businesses here that are originally from Uganda, so that they can help them, give them incentives, encourage them, give them services that can actually either elevate their businesses or make them as competitive out there in the business world. So I sent that information to them, and I encouraged everyone to register with the agency, because we need to see a viable business Ugandan community here that can come back and invest back in Uganda. when it comes to education, especially to the young. So these are the kind of partnerships that we build in UNAA that we know are helping the layman.
Well, if you can hold on to your point, Henrietta, because yes, you've actually taken us through the good job, the good work UNAA or UNAA is actually doing for and on behalf of Ugandans, both here at home and in the diaspora. But let's look at women, because this pandemic actually, yes, has brought, has again piled the burden onto the Ugandan woman, because the men are back home, and therefore the women, most of them actually fending for the families, because it's them, it's the women who are actively involved in agriculture. It's the women who actually involved in these small retail businesses that in most cases have been sustaining the families. So what plans or do you have for the women, or perhaps if you had to advise government, how should they help women sustain, develop their small businesses, develop their subsistence farming, so as to sustain the families?
Investing it back into these individuals and make sure that it helped them go a little bit a mile more than what they were doing before, because I knew that the pandemic had hit them. That is something that the government can also do to help these people find their voice or get somewhere and be better. If I hear of the Nabanja money, I know that that is coming through to some people, but there are some people who may not be able to get it. Why? Because of maybe what the threshold is that has been put out there. What I would advise is let them look at especially the village people. Let them work with the LC ones, let them work with the local village elders, and see how they can help, especially those people who are really looked at as the people in the low threshold sections, and see how they can pass on that money to them first, before they even look at the people in the towns. Because really, if you look at the people in the villages during this pandemic, I think they get hit because for them, when it comes to resources, it's even hard to get access to those resources. So I think I would really advise the government to find ways of giving them that incentive to at least get going, especially when it comes to sustainability of income in their thresholds.
Well, thank you for that. But to the contrary, actually, COVID-19, the pandemic has exposed people in towns because the urban poor is more hit than actually somebody in the village, because in the village they have their food. They are not renting, but here they actually don't have the food. The landlord is only their case. They cannot move out, and they have no jobs. So I think in towns, really, in Uganda, that is the situation. But also during the pandemic, we've seen places like Teso, places like the Rwenzori region, that is Kasese, being hit by floods, and such places or areas are now a double jeopardy. You have floods and you have the COVID-19. Now, how do you work with the local governments directly? For example, local governments in Teso, local governments in the Rwenzori region, Kasese, Wendibujo, to also lend a helping hand to such people?
Actually, honestly speaking, UNAA has not had that kind of relationship with local governments, but we usually work with our sister organizations. For example, when you mention TESO, Wendibujo, we have culture organizations that we work with, and we work with them through the incentive of the Community Development Fund. And most of them, when you look at the applications that have been sent in for those community development funds in the past, they center at taking care of their regional, their regions where they come from. For example, the Basogatwe Gaite, the NAMCA, which is the Bamasava Lango Association. So those are the people that we work with to be able to help those regions. You mentioned the floods in Teso. There are floods, I think, in Bugisu. Unfortunately, these are natural, they are natural caused events that we have no, we cannot stop them. They come, they are natural caused events. These are things that happen. But I think what we can do is encourage people not to settle in areas that are hit by these floods. Encourage people. Remember when we went to school a long time ago and we used to learn geography, there are certain areas that we knew that these are going to get mudslides. I wouldn't encourage anyone to build a house in an area that's prone to that, or areas such as the Baganda call them entobazi. I wouldn't be able to build a house in an area that's considered entobazi because I know it's going to be hit by flooding, and chances are whatever structures are there will be able to disappear. So we work through these cultural organizations to see that they help those regions where they come from, because we believe that working with the these sister culture organizations actually help us build better relations with the cultures at home, and also help us to grow the organization as a whole.
Well, I think time is not our best ally. We must prepare to get out of here so that we can give room space for the next program. But as a parting shot, the message to the voter in the United States who will be actually convening in September, what is your message to the Ugandans in North America who actually happen to be your voters? And secondly, your word of hope to Ugandans.
Okay. I'm going to start with the word of hope to Ugandans because I think it's very important. When I was in Uganda, I saw an advert that actually gave me hope as an individual. You have a campaign that says Chijja Kugwa. I think that is one of the most powerful campaigns that gave me hope that yes, at the end of the day, COVID will be no more. COVID one day will disappear, or it may not disappear, but we have to learn to live with it. Just like we have learned to live with diseases such as Ebola, diseases such as AIDS. So my message of hope to Ugandans is please follow the SOPs, the standard operating procedures. Make sure you're sanitizing, make sure you're washing your hands, make sure you are social distancing. Forget about this converging of parties and so on and so forth like people do, because chances are you're prone to spreading the disease. This variant that you guys have seen that came from India is worse than the first wave that hit us. Now, people talk about a third wave that's coming. We are going to be going into winter here, and we don't know if that's going to happen. Only the Lord knows. But we are going to continue doing what has been taught to us to be able to survive. And I actually would like to pass that on to my fellow Ugandans at home. Chijja Kugwa, at one day, COVID will not be COVID as it is today. But in order for us to get there, we've got to follow the standard operating procedures. Now, to my Ugandans in North America, we have an upcoming convention that's coming on, and that's in the next 4 weeks from September 3rd through September 6th. I encourage you to come and be with us during the convention. If you're not able to come, at least we are going to try to see if we can have it also broadcasted online. We are working through the mechanics to do that. But support your organization. Please come and be there for the organization. We have our annual general meeting that's being organized by our Board of Trustees. Make sure that you come and attend that meeting, because there's a lot that we are going to discuss about for the organization, especially when it comes to how the organization is going to move forward. There's a constitution review that's being done, and we would like you to know what those reviews are, given the responses you have given to the Constitution Review Committee, so that you know what we need to change for the organization. Now, yes, I am standing for re-election for office of the presidency, and I would love and humbly to ask for your vote. With Henrietta, you have seen me deliver. I'm not about lip service as other people are. Usually in UNAA, you get a lot of people who come and promise heaven on earth, but you'll never see deliverance given at the end of the day. With my team, it's a team of action. When I say we are going to deliver something, we make sure that we follow through. our word is always going to be our bond. And with my team, you're going to continue to see us advocating for diaspora as we have done. Most chances, I am working on making sure that we increase our scholarships from the $60,000 threshold that I set this for my administration this time. And I want to increase and double that to 120 or even more. I'm going to continue expanding and building partnerships with reputable immigration lawyers, because that is something that we know our members need. We are going to continue engaging our Canadian counterparts so that they don't feel left out as they have been in the past. We are going to expand our women empowerment program through partnerships with other entities that champion women empowerment. We are, of course, going to now focus on job targets so that we make sure that our members get reputable jobs. Remember, we have been in COVID, but COVID has not stopped us from working. And we have continued working with the entrepreneurs in our organizations and making sure that we encourage them to build their businesses. We are, of course, going to continue promoting health sensitization in our communities because this pandemic still continues. But most of all, we are ensuring fiscal discipline in the organization. We are ensuring transparency. We are ensuring integrity when it comes to running systems of UNAA. And our financial team has now produced a financial policy that we will be unveiling to our members, because we would love to see that this organization is taken seriously by its partners, by those that feel they need to sponsor us. And also, we would love to make sure that at the end of the day, when we are reporting to the federal government, whatever we are reporting is clear and it is correct. So the other issue that is dear to our hearts is we are going to continue working on the life insurance coverage for our members, because it lessens the burden for those survived loved ones at the end of the day. You know very well that in the diaspora, we always lose our members. And one thing that has been bothering us is to pass crowdfunding emails asking people for money to bring those bodies back home. But with the UNAA you have today, we have now a life insurance program and a repatriation program, and we have lessened that burden on our members. So with Henrietta, in the coming term, with my team that I'm bringing on board, it is going to be a progressive UNAA. It's going to be a UNAA that builds on to the good that we have had in these times, the COVID times that we've gone through. And most likely it's going to be a UNAA that delivers services to its members fully, but also extends an arm to our country, motherland, Uganda. Thank you so much. And we look forward to seeing you in Cincinnati and humbly ask for your vote. Thank you so much.
Yes, Amma, thank you very much, Henrietta Wamala Senavulia, the incumbent president of Uganda North American Association. Of course, the other part is that the last minutes of our Let's Kick COVID-19, you actually did your campaign, but also, which is also very, very important, so that people really can know who is this person and what she has actually done for the country. Yes, it's always our pleasure that you people in the diaspora join hands with the government in fighting pandemics, in actually lending a hand and also lobbying for your country. For God and my country, Amanda Kuala Mazima saying bye-bye.